Well, good morning, good afternoon to everyone who's joining and anyone who's watching this video. Um, we're back for another Tuesday Ask the Doctor with Dr. Jim deMaine. If you're in the Pacific Northwest, we're experiencing a massive heat wave. We're at the tail end, but we hope that you are doing okay and have been over for the last couple of days. Unprecedented heat in the Pacific Northwest. But today we're going to talk a bit about organ transplantation and some kind of more extreme conditions and decisions that people have to make in a bit more of a rare occurrence, but very, very important when there is brain death or when somebody is in other ways non-responsive to medical care. So welcome back, Jim. The floor is yours.
Thanks very much. And, the issue of organ transplantation is a personal one to me because I'm a recipient of a partial corneal transplant to both eyes. And it was absolutely life-changing. At one point, I could no longer drive at night. I was seeing halos. And this procedure from receiving a partial corneal transplant from a person that was brain dead and donating their organs was certainly life-saving for me and many other recipients of various organs. So I'd like to read you a story from my book about brain death and about this decision. It's a case that I was personally involved with and actually had some follow-up from the family afterward. So this is from my book, Facing Death. Sam was late and Ella was furious. Why isn't that man back now? He knows it's time to leave for church. Hours passed and Ella became concerned. Sam had gone out for his usual 2-mile run and simply disappeared. Ella called friends and neighbors, but no one had seen him. Ella began to panic. She called 911, which connected her to the police. No, ma'am, we've had no reports with anyone by that name. In desperation, Ella began to check area hospitals, but they had no knowledge of Sam. Ella then checked the bedroom and found his wallet, car keys, and cell phone. Of course, they didn't know anybody by that name, she realized. He has no ID on him. Finally, she got through to an administrator with the medic crew. That morning at 10:03 a.m., they'd received a call from the Metro bus driver that a man was down on the sidewalk and not moving. The medics found him not breathing and no pulse, and his heart was in ventricular fibrillation. That's just vibrating motion of the heart without effective movement. CPR and shocks got his circulation reestablished, and he was admitted to the trauma center as a John Doe and kept on life support. When Ella had located him and arrived at the hospital, she found her husband in the ICU. She reeled in horror. A tube protruded from Sam's mouth, another tube from his nose. A heart monitor was quietly beeping, and IVs flowed into his neck and arms. Is this really happening? Have I lost him? Ella thought to herself, while trying to be brave for her 2 teenagers. The family was in shock. Sam had gone into cardiac arrest while jogging, and his heart rhythm had come to a standstill. Now his heart, lungs, and kidney were all working again, but what about his brain? Over the next few days, Sam underwent extensive testing. There was no significant brain activity visible on his EEG. Even more discouraging was the complete lack of blood flow to the higher centers of the brain. Sam's body did not even attempt to breathe when the ventilator was paused for a brain death protocol check. Any hope of Sam returning to his prior life was nil. He was legally dead. The criteria for brain death are quite stringent. The Uniform Determination of Death Act was enacted in 1981 and defines it this way: an individual who has sustained either irreversible cessation of circulatory and respiratory function or irreversible cessation of all functions of the entire brain, including the brainstem, is dead. The brainstem is important because that's where your breathing center is located. So a person may be declared brain dead even as their heart and circulation continue. This is not any kind of coma. Legally, the person is dead. But explaining that to a family can be difficult. Their loved one does not look dead, but they are, even if circulation is ongoing. Sam became my patient and my responsibility when he was transferred to my hospital for, in quotes, ongoing care. Apparently, the referring hospital decided not to take the step of removing him from the ventilator. As a treating physician, my obligation is first to the patient and then to the family. Sometimes this is easy, but sometimes loaded with conflict. Fortunately, Sam and Ella had a strong family with two beautiful teenagers, Adela and Isaiah, who wanted to help their mom. Together, we discussed the hopeless situation of Sam's brain and the options of continuing ventilator support, actually a better term here than life support, since legally he was no longer alive. And of course, he had a feeding tube as well. The staff neurologist explained the total absence of meaningful brain function. The family met with their pastor, then with the hospital social worker. In conference, they all felt that Sam would want to be removed from the ventilator and allowed to die naturally and peacefully. When I went into the ICU that afternoon, I listened to their pastor reading to them from the Bible, from the book of Isaiah. For you shall go out with joy and be led forth with peace. The mountains and hills shall break forth before you into singing, and all the trees of the field shall clap their hands. They were celebrating Sam's life, it seemed to me. And the pastor further explained, the soul is present, but the body too damaged to further clothe the soul. The real Sam will live on. Yet his body, while on life support, was still functioning. His organs were still alive. Ella and the children were quite taken aback when a transplant coordinator asked to meet with them. The ICU staff, per protocol, had notified the regional transplant center about a potential organ donor. Ethically, it was important for me to keep my distance from the transplant team and remain focused on Sam, my patient. So Ella, the kids, and their pastor agreed to meet with the transplant coordinator to discuss how Sam might benefit others as a donor, possibly more than a dozen people. Through saving their lives with organs, he could, in a sense, live on. But the prospect made Ella queasy. Isn't this disrespectful to him, she said. How can I allow my husband to be cut open when he's barely dead? As with most medical innovation, the ability to perform transplant has opened a whole new arena of ethical questions. In 2016, for example, a patient with ALS, Lou Gehrig's disease, on a ventilator, said he wanted to donate his organs by being admitted to the hospital and removed from his breathing support. The doctors agreed, but the hospital attorneys felt this was too close to assisted suicide. The ALS patient was denied this request. In Sam's case, though, there was no confusion. He was gone. Ella prayed, and in the end, she found greater peace by carrying out Sam's wishes to be a donor. The children appeared bewildered, but they accepted the decision. Their tears flowed. Although Sam had never completed any advance directive, he had done the most important thing. He and Ella had had that all-important discussion about their hopes and fears and what mattered most to them. Sam had told her, I would never want to be a vegetable. If that happens, let me pass. As Sam's spouse, Ella was legally his surrogate. In this regard, he had done her a huge favor by letting her know his deepest wishes about life and where he drew the limit. I'm not sure how many organs were harvested from Sam. His heart was allowed to stop for 120 seconds to ensure that death was complete. No heart will spontaneously restart after that time period. This was a precaution, even though he had been legally dead for 3 days already. There will likely be continued debate about what actually constitutes death. Although brain cells choked of oxygen begin to die off within 5 minutes, some can be retrieved and grown in a laboratory hours after death. So when is a patient truly dead? Also, I might add here that even when somebody has brain death, their endocrine functions can continue from lower brain activity, could even complete a pregnancy and respond to wound healing and that kind of thing, even though you might be legally dead. So anyway, 8 years after Sam's passing, I received a phone call out of the blue from Ella. Hi, Dr. deMaine, do you remember me? Some patients stand out, and I immediately recalled the situation and trauma of Sam's death. Ella said she wanted to thank me for my care, but she was really calling to let me know that the children have both graduated from college. Then shyly, she mentioned one more thing. For the first time since Sam's passing, I've started a relationship, and I'm so happy, she said, noting that while the pain had never completely disappeared, life had presented her with a new and unexpected chapter. So if you're interested in reading more about that controversy, excuse me, I would suggest the blog by Thaddeus Pope. One of the things about determining brain death, the language of the law says the entire brain has to be gone. Well, what do you mean by the entire brain when you can still have the pituitary gland and other glands in that orbit still functioning, but your integrated brain function is entirely gone? So there's talk of maybe rewriting, but at any rate, Sam met all the criteria and was allowed to go. But these are difficult situations, and there is a scarcity of organs in our country, particularly heart, kidneys being a major one. There's long waiting lists for people receiving organs, and the ethical dilemma of how to rank people on those lists to get organs. State of Washington, anyway, you can indicate on your driver's license whether you want to be a donor. And there are websites that you can go to for signing up to be an organ donor. I would encourage everybody to do that. It's one way of leaving a legacy for sure. So I'll open it up here, Michael, and let's see what kind of questions are coming in. It's kind of a difficult area, but also a very important area.
Yeah, well, and I think moving beyond just brain death and organ transplantation to talk about organ donorship in general, I think we can spend a little more time there, because that's also something we can all relate to. But anybody who does have questions about this particular topic, go ahead and use Q&A, or you can ask a more general question around end-of-life planning from Jim. Let's, so Bob, hey Bob, welcome back. As a question, does age matter for accepting donations? Would an 80-year-old be wise to donate? So criteria for somebody who wants to be an organ donor, and then I imagine you can also talk a little bit about the criteria for how the medical system determines who receives transplants, how that list is created, on priorities.
Yeah, in terms of who can be an owner, if there's an age cutoff, there is no age cutoff. Now, if you're 80, 85 years old, they may not want your kidneys or your heart, but things like skin, cornea, sometimes bone chips, those kind of things can be used. So it's better to just ask than not volunteer at all, because you may be surprised that they need some of your vital parts, even though they may not want all of you. And in terms of drawing up the lists, I'm not really expert on how the lists are drawn up, but I can give an example of a friend who was in his 70s and suddenly found he was in kidney failure. So they first wanted to make sure that he did not have a serious underlying disease like cancer. So I can't tell you how many prostate biopsies he went through. And then he had to have a heart catheterization to make sure he didn't have severe coronary artery disease. So they wanted to make sure he was physiologically young for his age. And then, they have I would imagine it's computer based in a national registry now for organs. And unfortunately now my friend is up about 84, 85, and his kidney is starting to fail. And he's beyond the age cutoff to receive another kidney, because there's people younger and healthier than he is that will make it onto the list before in fact, he had to wait about 3 years on dialysis before he got his kidney. So, you get a call, be ready, come in. And then, oh, I'm sorry, the kidney's not in good shape. It's not transplantable. You have to wait for the next time. So it's kind of sitting by the phone, waiting for it to ring. When am I going to get that call for the transplant? So a lot of anxiety and wait time on the recipient's part. But now my friend who's in his mid 80s says the kidney is having more difficulty. They're trying to keep it going, but at some point in the not too distant future, we'll have to decide on dialysis again. So the kidney was a very good bridge for quality of life for at least, I think, 15 years.
Yeah. Well, one thing that I learned, which was shocking to me, was that heart transplants, maybe this is the case with other organs, only last a certain amount of time. So if you're a teenager, heaven forbid that you need a heart transplant, or 20s or 30s, there's an expiration date on some of these transplanted organs, and it's unclear how long that transplant is actually going to be effective. It can be 15 years, 20 years, 25 years, can be less. And can you speak to that? And
yeah, that is an issue, just like my friend with the kidney. The thing that revolutionized organ transplantation was the development of the drug cyclosporin, which suppresses your immune system so you don't reject the organ. But it is a foreign substance in your body, and unless you happen to have an identical twin, then you can probably have a normal life existence for that organ. Honestly, I don't know just how long hearts last or lungs last, but they are fraught with episodes of rejection. You have to monitor things very closely, and they don't have a normal life because they are a foreign substance and you are taking immunosuppressive drugs. And of course, these can cause problems in and of themselves with various infections that can precipitate rejection. My friend that had the kidney transplant had 2 very serious viral infections right after the kidney transplant, had to be on very toxic drugs for a while, which may have actually harmed his kidney some. So it doesn't mean you shouldn't get them. I mean, I guess isn't former Vice President Cheney still alive with his heart? There was always the question of how he got on the list, but
lots of questions about his heart.
Yeah, a lot of questions.
A question from Harold. Harold is a full-body donor for medical education and research, with paperwork completed with the University of Connecticut. That's mutually exclusive with organ donation. Your view of prioritization. So if you're one, you can't be the other, right?
Well, yeah, often when you donate your body to a university, which can be done here in Seattle too, they would use it for dissection and learning anatomy for students. My first half year of medical school was 4 of us assigned to a cadaver, and that's where we spent half our day and a lot of our evenings was learning anatomy. And that's a very important donation. And some of those, to get a person for transplant, often in a lot of deaths, you can't get to the person soon enough in order to get viable organs. So the default in that situation, if the person has donated their whole body, if they're found dead in their bed at home, they're not going to be a candidate for organ transplants as a rule. So I can't say one is more valuable than the other, but being a transplant recipient myself, I think ultimately it makes more difference to the individual if you can donate your organs.
Yeah, absolutely. And then Bob had another question. What is the typical timing for giving a transplant? I'm wondering how it will affect the timing for the cremation process or date of a funeral.
I don't think it should interfere, because once the organs, the patient is clinically dead, and they're kept alive for a transplant team to come in and remove the organs, and that should be pretty quick. In the major centers, you have your transplant teams that come in and harvest the organs. Then they have to begin to match, where they're going to send these organs.
I froze or Jim did.
There's private flights that can carry organs to just about anywhere in the country, and the private flights. I knew a pilot, that was his job, was to fly organs around the country. So, once the organs have been removed, there you are again. Once the organs are removed, then the body can have whatever disposition the family wants. So it shouldn't, there might be problems with certain religious faiths that want a burial within 3 days of death. But, from that standpoint, you could say the time of death, or you could budget a little bit and say it was the time after the organs were removed, and then the person is for sure dead.
Yeah. Well, other interesting thing I learned about organ transplant and donorship is that oftentimes, one, there is a great deal of anxiety and stress and depression for people that are on lists waiting.
Yes.
As a donor. And it can affect a whole family and a whole community. And I talked to one son of a donor list participant, and just how it impacted how he saw the world, and couldn't believe that people wouldn't be, willing to be organ donors when his father needed something that was in such short supply and so many people have. But also that there is that it can be very difficult, not just from a physical side of somebody who's received a transplant, but emotionally, there is a lot of survivor's guilt. And when you do have a successful transplant, and those people who have had transplanted, we need to give them a whole lot of support, because there's a lot of uncomfortable feelings that come with that new lease on life. Any thoughts or experiences there?
Yeah, I went to a conference, a friend of mine that received the kidney, and I went to a kind of a support meeting for donors and recipients over on the east side of the lake in Washington. And at our table was a young Microsoft fellow who was simply a volunteer anonymous kidney donor. He was in his 30s. He said, people need organs. I've got 2 of them. Why not donate one? And my friend at the table, who was a kidney recipient, not his kidney, obviously, but was kind of blown away. And the 2 of them had a kind of a great mutually appreciative conversation. Another fellow at the table was the recipient of a heart transplant. And, one of the things they ask you to do is to write a letter of thanks to the family. And that's a difficult letter to write, because you do have that survivor's guilt, that recipient's guilt, your joy and their sorrow. Yet on the other hand, and it depends on the family dynamics, the family can be very proud that they helped somebody else because their loved one had died, and yet they're living on in another way. So there's a lot of potential dynamics, but yeah, there can be some survivor's guilt for sure. But there's another aspect to transplant. Some people will go offshore. They'll go to India or other countries or Thailand, where they might be able to get a black market organ, kidney. And actually that was mentioned to my friend, and he, just on ethical grounds, he said, no, I would never do that. But it is a black market industry, unfortunately.
Yeah, what a wild topic, and what an amazing thing that science has developed to the point where we can have a successful transplant surgery. And I mean, maybe you can talk about this a little bit, especially from a kidney perspective. My understanding is the cost of dialysis and the cost of treating diabetes, specifically for people who are severely diabetic, over a period of time versus a transplant remedy, that there's a huge gap between those things, and there's such a huge deficit of need, in specifically kidneys. I wonder if you could speak to that, and then I think we might be at time.
Wow, already. Yeah, the one thing that Congress did for end-stage renal disease, they saw that this was going to be hugely expensive, is they essentially covered it with almost like socialized insurance. So dialysis is actually covered along with the supplies. It's kind of like a Medicare for all coverage for dialysis. Now, diabetes is totally different. There's no such coverage for that or the other associated diseases. And of course, transplant is another issue that would have to be faced by your insurance and coverage. But end-stage renal disease is peculiar. It's kind of like a socialized disease. And it saved a lot of people from going bankrupt, and it actually promoted the whole industry of dialysis.
And there is one last question from Wendy. How is it determined if a person is healthy enough to be an organ donor?
Well, that's determined, medically, and sometimes they don't know until they actually remove the organs to see what kind of shape they're in. Obviously, if somebody, I think almost anybody can be an organ donor because they can use corneas, they can use skin, they can use bone. But in terms of taking a lung, certainly somebody with emphysema or a smoker or somebody with coronary artery disease or somebody with significant kidney disease, they're not going to be able to use those organs. But just because you have an illness, I wouldn't sign yourself away from being a potential organ donor.
Yeah, absolutely. Let somebody else make that determination.
Absolutely, yeah.
All right, Jim. Well, once again, learning so much and tackling some very difficult topics.
Yeah.
We'll see you next week for our final summer version of Ask the Doctor before we take a break. So we'll see.
Try to have a little happier story next week. And on a more positive note.
Well, we'll see everyone next Tuesday. Thanks again.
Thanks.